Thank you so much. Hi, what an awesome crowd. Thank you so much for having us. As Petra mentioned, I'm Kristin Muhlner. I'm the CEO and co-founder of Affect Therapeutics. I think everyone in this room is sadly familiar with the problem that we're trying to solve. There are 50 million Americans suffering from a substance use disorder. Think about that for a second, 1 in 6. Right? It's extraordinary. And only a small fraction of those people actually seek treatment every year. Stigma, access to care, financial concerns, and just candidly lack of motivation keep people from getting into treatment. And the result is this staggering cost to our economy and our healthcare system that is estimated at $500 billion a year. So that's why we developed Affect. We want to bring high quality, accessible care to the millions of people who need it. We are an in-network digital healthcare provider serving adults with substance use disorders. In just a little over 18 months, we have treated 5,000 patients, and we've grown to be the only nationally scaled treatment provider serving individuals across a variety of illicit drug and alcohol use disorders and across a continuum of care that includes both outpatient and intensive outpatient treatment options. We built our digital solution to really support people throughout their recovery journey and, quite candidly, throughout their lives, because substance use disorders are a chronic condition and they always have to be managed. Whether someone's contemplating treatment, whether they're ready to get started, whether they're actually enrolled, whether they're relapsing, or whether they're considering returning to treatment, our platform and our care team delivers a highly curated, very specific set of high-quality care and content to those individuals, customized to their particular needs. That platform, incidentally, is fueled by one of the largest data collection engines and analytics engines that has ever existed in addiction psychiatry. Over the course of the last couple of years, we have amassed 25 million individual data points about our patients, about their activity, and the correlation with their outcomes. We're literally walking around in their pocket, understanding how they feel, what their cravings are, everything about what's going on with them. And that's fueling optimization to our clinical system and, of course, to their member journey, which is just extraordinary and, quite candidly, would not be available in a traditional brick-and-mortar treatment solution. So their journey starts with access to our app. It's designed to help motivate and inspire people in moments when they're often pretty low, right? We want to gather information about them. We want to understand what's going on with their health, their prior experience with treatment, how much they use, what's going on in their lives, what their motivation and what their goals are. And then with that information, we can pair them up with a highly empathetic peer support specialist who understands their needs and can help them in that decision-making progress to navigate that sort of decision to step into care. With that process, we're able to achieve unbelievable admission rates, and we're also, really importantly, able to reduce that time to care that is one of the biggest challenges in this space. Today, from first touch to actual intake and admission, we are under 2 days. It's just extraordinary. Thank you. Pretty excited about it. Once our members are enrolled, they're assigned to a care team that includes a counselor, a medical provider, and a case manager. They are provided with group and individual therapy, with biologic testing, with medical oversight, with prescriptions, and with case management to support their social determinants of health. All of our clinicians are fully licensed and they're employed by us, so we can control the care, we can control the quality, and we also absorb a very high credentialing cost for doing all of that. But in any case, we wrap this entire system inside of a really powerful user experience that rewards healthy behaviors and helps people achieve their sobriety goals. This experience is known as contingency management. It's based on operant conditioning by Skinner, if any of you are psychiatry or psychology studies. And effectively what we're seeking to do is reward behaviors so that we can habituate those behaviors over time and help people start to make healthy choices instead of choices to use drugs and alcohol. So a show of hands, how many of your mothers gave you dessert when you ate your vegetables? Mine did. How many of you have been inclined to fill up your shopping cart with an extra $25 of product you really didn't want because you wanted free shipping? Yep. All right. You get it, right? Those were contingent incentives. It got you to do something you might not otherwise do, and it likely got you to do it over and over again, right? So that's what we're looking to do. These are really well-researched, employed in techniques that are employed in video gaming and social networking and e-commerce. We're just using them now in healthcare to help people achieve their goals. So the question is it effective? And of course, a resounding yes. We're so pleased with the outcomes that we've been able to achieve. Our engagement in treatment, meaning the way that people show up, their attendance, is 3 times the national average. Petra mentioned HEDIS gap closures. This is an area where we're pretty excited about what we've been able to accomplish. That engagement translates to retention in treatment that is double treatment as usual. And that's important because what we know about retention in treatment is the longer we can keep people in treatment, the more likely they are to achieve sustained sobriety and to achieve long-term health. Most excitingly, though, we also see that our members, whether they are active or discharged, are 90% less likely to end up in the emergency department. That is an extraordinary cost savings for employers, for United Healthcare, for Medicaid plans, and it allows us to help people get re-engaged in the primary healthcare system and stay out of the ED. Today, we are the only telehealth treatment provider offering support for most drug and alcohol use disorders across a continuum of care that includes intensive outpatient treatment. But as you can imagine, we're not done. We want to serve everybody. So we'll be expanding into a variety of other areas of substance use disorder over the coming few months. And we're also excited to start to expand into more severe, complex cases, including remote withdrawal management, which is an extraordinary costly problem, as well as down into moderation opportunities as well. Our dedication to quality and our patient outcomes have driven pretty extraordinary growth over these last couple of years. We've grown year over year 400% and anticipate doing the same in 2024. We've achieved facility licenses in 22 states, and we have a plan to get to all 50 within the next couple of months, which we're quite excited about. We've also amassed health insurance payer contracts covering 125 million lives across employer, marketplace, Medicaid, and Medicare. And we truly are positioned to be the uncontested leader in this space. As you can imagine, we're maniacal about our member success and gathering their feedback, and we're thrilled that our Net Promoter Score is double that of most healthcare providers in the industry. Thank you. And I could share with you any number of unbelievably heartbreaking or unbelievably heartwarming stories. But I'll leave you with one of my very favorite quotes from a member. "This program has changed my life, and I do not believe that I would be here without all of you. I don't know why it works, but it does. This program is like an orgy. You walk away feeling good, but you don't really know who did it." Funny and appropriate, but it's true. So, in summary, we've pretty quietly built a highly effective, highly differentiated program with national scale and the ability to impact so many lives. My ask of this group is just to help us get the word out. Tell your colleagues, tell your employer clients, the larger payer community, and most importantly, individuals with substance use disorders who might have the opportunity to find their better future with affect. Thank you.